Okay, here we're doing a midline insertion for Powerglide. Patient needs a few days of antibiotics, non-vesicant ceftriaxone. Got mixed feelings about that, but since it's only for about 5 days, we're going to go ahead. All right, so patient's got a great, very shallow basilic vein here and about the green zone. And then we're going to go up to the yellow zone and assess. There we go. Looks pretty good. Looks like it's good flow. Okay, looks pretty clear. I don't see hyperechoic obstruction. Vein is quite easily compressible. And we could tell it's compressible because of how light the compression I'm applying, and it's collapsing the vein completely. We can discern that this is the artery by applying a little bit more pressure and seeing it pulsate. And then of course we have the hyperechoic circular image, which is the brachial nerve right there. You can see like a small porous looking structure that is circular, non-compressible, shiftable, but generally non-compressible. Right now I'm just using a heparin bullet. This right here is also a possible nerve bundle. We want to avoid that when we're needling. That's definitely a nerve bundle here. Muscle with this outline. You can see the striations. There we go. So we're going to insert the green zone. He's got let's check from 0 compression. In the green zone, which is from the axilla to the AC crease, we're going to go right in the middle. In that plane, it looks like his compression, or it looks like the vein is about 1.5, maybe even 2 centimeters deep when fully uncompressed. With no pressure. So it's a 2 centimeter depth. A little deeper than I like, so we're going to go at a quite shallow. We're going to try to insert at a shallow angle. I'm going to compress the tissue so that the vein goes from 2 centimeters to about 1 centimeter without compressing it completely. Now I'm compressing the tissue, but I'm not compressing the vein. And so I'm going to insert at the 1 centimeter because I want a low angle of attack. Now, to double check, but I think these Powerglide needles, it's a 10 centimeter length. It doesn't show the length of the needle. At least I can't see it off the bat. Yeah, I don't see it, but I think it's about 3 centimeters last time I measured. I have to double check. Don't quote me on that. However, we're going to insert in the green zone and get it going there. I'm going to show you guys how to use a Powerglide. This PIV insertion, we're going to use sterile gloves, maintain sterile field for as long as possible. While I get all this ready, I'm going to scrub the site. We're going to do a full minute. Scrub. Oh. Okay. Apply gel or saline at the site, whichever you prefer. Now the most important thing to be mindful of, the reason why I like this Powerglide is got a guide wire to help guide it past this this needle, which to me it's kind of short. I gotta measure it later when I get home. So I gotta maintain a shallow angle from right about here. Un poco dolor, ¿ok?
Sí. Te voy al baño, que siento dolor.
1, 2, 3. Lo siento. So I want to maintain that shallow angle if I can. I'm going to get okay, not in yet. There we go. Felt a little bit of a pop. I don't think I'm fully in. You do not want to try to insert the guide wire until you're sure that you're in the vein. I felt a really good tissue pop now. Tissue pop now. Tissue pop now. That was it. You could even see it. The tissue release. So I think I'm in pretty good. I'm gonna advance the guide wire. Now when I advance the guide wire, it's gotta be smooth. You do not want to advance against resistance. If you feel resistance, and let's watch that under ultrasound. Okay. All right, so here's my needle. It's my guide wire passing the tissue. We're passing in the vein pretty well. And then now I'm going to advance. Locked in. Now I'm going to advance the catheter. You can see the catheter going in smooth. I don't feel resistance. Feels great. All 10 centimeters. Okay. So we're going to hold the wing and pull out until that part of the needle comes out. Until this part comes out. I'm going to pull that out. And then replace that with that. Now it's a little messy because I pulled on the plunger part, the blood stopper, to show you guys that piece. That was my fault. However, we're going to give it a good flush. Good blood return, good flow. I feel no resistance when flushing. So now, I'm gonna clean up my mess that I made. And the problem with all this gel is that's gonna prevent the adhesive from sticking well. Okay, so we're gonna let that dry. Apply the skin prep. Okay, we're gonna let that skin prep dry. So here's how you apply the StatLock 4 Powerglide. I would make sure the skin is taut. And there are these nubs. You're gonna match it with the nubs here. And it's gonna click into place. And you wanna click and lock that into place before applying the adhesive. Okay. Here's the Covalon. Okay, we're going to open the larger tab first. Apply it as much around as possible. Take off that second smaller tab. There we go. And we're going to cover that insertion site as best as we can. I want to get that silicone tackified to every cellular groove as I can. Take some extra time to press and get it really well adhered in there, especially in the pores, all the surrounding grooves of the skin. I like to add this on here. It's just a little bit of an extra securement, and then date and time it. Then, if you want some extra securement, you can apply some on top. Make sure to cover both skin and dressing. And then here are the pants, as some of us say. The silicone dressing part is supposed to be soft on the skin, not these cloth parts. If you're worried about sensitive skin, do not apply these. These are to help with extra securement, but the dressing itself, the clear part, very soft on the skin, very good for sensitive skin. Highly recommend. It has worked very well for most, actually all of my sensitive skin patients.